Hi and welcome back to this channel. My name is Susan Selantoe, and in this channel we are creating a politically empowered generation. Alright, so in this episode we're going to talk about the vaccine, the COVID vaccine, and this is mainly based on the information that is given to us by the Ministry of Health of Kenya. And a disclaimer, I am not a medic and I am not a scientist, so I'm not able to answer medical questions about the vaccine. However, in this episode, we're just going to give you information about how the Ministry of Health is going to distribute these vaccines. So we can just be more aware of that process. And we'll do this by answering specific questions. When are the vaccines coming to Kenya? Which vaccines are we going to get? Who is paying for these vaccines? How much are we spending for it? Who gets the vaccine? And where is a vaccine being administered? And what is the Ministry of Health doing about this? So vaccine and COVID has become a political issue, and so this is why we are discussing it here. Alright, so let's get into it. Question number 1. When are the vaccines coming to Kenya? Alright, so the first set of vaccines came to Kenya on the night of the 2nd of March 2021. Vaccination is expected to go on between March 2021 all the way up to December 2023, meaning that we will be getting different sets of vaccines after every probably few months. And so the first one came on the 2nd of March, the next one is expected to come in May, and then it'll keep coming as we go along. So yes, so we got the first batch of vaccines on 2nd of March. Alright, so which vaccines are we getting? So there are different types of COVID vaccines, and they're different for different reasons, but we will not get into that. The vaccine that we are getting is called the AstraZeneca vaccine. This type of vaccine is the one that is administered twice. You get 2 doses. Ina maana ya kwamba mtu mmoja anakunywa vaccine mara ngapi? Mara mbili. So ideally when you get your first dose, it'll take you at least between 8 to 12 weeks for you to get the second dose. But if you are receiving this vaccine, you'll definitely be alerted on when you need to get your second dose. Okay, so there are various countries that have gotten this kind of vaccines. This specific one, the AstraZeneca one, these countries include places like India, Ghana, Nigeria, Ivory Coast, just to name but a few countries that have gotten the same vaccine as us. Alright, who is paying for this vaccine? Okay, so first of all, the Ministry of Health has estimated that they will vaccinate about 15 million people, and this will cost us a total of 34 billion Kenya shillings for the entire process, not just the vaccine itself, but for the entire process of the rollout. This means that, the entire process will include something like the infrastructure needed for the vaccine to get to you, training of health workers. This is a new vaccine, so they have to be trained, the personnel that will be needed for this. So it's not just the cost of the vaccine, but it's the vaccine and the entire process as well. So the company that produces the AstraZeneca is called Gavi, and Gavi has given Kenya a 20 billion Kenya shilling grant in form of vaccines. So basically, wametupatia vaccines for free. A bunch of vaccines for free that will cost us about 20 billion. So if we're spending 34 billion, 20 ndio ishalipiwa, how many are we left with? We're left with 14 billion. And that 14 billion is going to be footed by your government, by the Kenyan government, to set up on infrastructure, all those things that we talked about, the process for having the vaccine done. So that's who is paying for the vaccine. It's both you and the company that produces the vaccine. So I know a lot of you would think, okay, when it comes to procuring anything by government, you think about COVID millionaires, but there are a few measures that have been put in place for this. In fact, the actual vaccine is not being given directly to the government by Gavi. It's actually, the procurement is actually being done through UNICEF in Kenya, just to mitigate some of those corruption issues. The vaccine has been donated to us. And then the Kenyan government is going to pay for the logistics for it to get to you. Now, you might be wondering, see, we're being given the vaccines for for free. So how much would it necessarily cost you or me as a person to get this vaccine? And so the ministry has said that if you get these vaccines from a public health facility, facilities are gava, you get it for free. But if you get it from a private facility, then it's going to be 200 Kenya shillings per person. So that is information from the Ministry of Health. All right, so who gets this vaccine? Like, nani anapata wa kwanza, nani hapati? What is the process hapo? So the first group of people to receive these vaccines, the people who are priority, are three groups of people. The first one is health workers. And by health workers, I mean people who work in a hospital. So you'd have the medical staff, doctors, nurses, clinical officers, but then you would also have people who work within that environment. So it could be support staff within the health facilities, it could be administration staff, it could even be the security person at the health facility. Those are the people who are going to be first priority to get the vaccine. Now the second group of people are teachers and people who work in schools. And the third one is going to be security personnel, people like police. So that's the first group of people who are priority to get these vaccines. This group of people is going to keep growing as we go on. So the second phase is going to have, people who are older or have underlying conditions. The third one is going to have more people. So it'll take a while before vijana baru tupate vaccine, but really they've given priority to health workers, to teachers, and to security personnel. All right, so the other thing that you need to know about who is getting the vaccine, in addition to those groups of people, no one is going to force anyone to get a vaccine. Getting a vaccine is voluntary. Kama utaki, unaweza kaa. So nobody is going to be forced to get the vaccine. And the Ministry of Health has actually tried to do other things to make sure that you can get the services closer to you. So there's a portal online. I'm going to link it in the description. It's www.chanjo@health.go.ke, where if you want to get this vaccine, if you're in this group of people, if you're a teacher, you're a health worker, you're a security personnel, and you'd like to register for the vaccine, you just get on that link and you actually register yourself online, and it'll direct you to your nearest facility, and it'll pick out some of your details, and that's how you register to get your vaccine. So you don't necessarily have to go and queue in line, or you can just book it online first. So I think it's nice, right? I mean, if the government is doing something nice, sometimes we need to appreciate them. Okay, so those are the groups of people who are priority. Number one, healthcare workers, teachers, and security personnel. Okay, so where is this vaccine being given? So it's going to be given in phases, obviously, just like everything else. It starts somewhere and then it grows towards other places. So we'll start at the initial phase of the rollout. There'll be one hospital per county that is able to give out vaccines, and this is going to be either your level 4 or level 5 hospital or a national referral hospital. I know we've not talked about how healthcare is structured in Kenya, but we'll do that in an episode coming soon. But basically what this means, if you're in a specific county, most likely the biggest hospital ndio itakuwa inapeana vaccines. So that's what they mean by level 4, level 5, or a referral hospital. And then eventually they'll cascade it down now to smaller hospitals. Then after that, they'll now give it to faith-based hospitals. These hospitals that are owned by Catholics or churches, or mosques. I don't know if mosques do mosques own hospitals? Anyway, yeah. And then private hospitals after that. So it'll start with one hospital per county, and then it'll keep growing as we get more vaccines. All right. So yeah, so far we've answered all those questions. Now, what is the ministry doing? The ministry is training healthcare workers to be able to give out this vaccine. So the ministry is using technology in this process to make things easier, including things like they'll notify you when your second dose is coming, so that in case you forgot. Yeah, stuff like that. So they're doing quite a bit. They're going to be doing a lot of communication work to let you know what you need to know about this vaccine, and where you can get it and how you can get it. Yeah, so that's just about it. There's another thing that probably we'll need to know. People in that group of people, in the group of healthcare workers, teachers, and security personnel, you're not supposed to get this vaccine if you're pregnant or breastfeeding, and also if you're under the age of 18. And you're meaning that you can't be in any of these groups, but so that's fine. Yeah, so under 18s are not supposed to get the vaccine, and women who are pregnant or breastfeeding. Yeah, so I know there's a lot of rumors going around about vaccines, and there's a lot of misinformation out there. And yes, there are still studies going on about all the COVID vaccines that are there in the world. But the Ministry of Health and the WHO globally, the World Health Organization globally, have continued to assure people that the vaccine is safe. And yeah, so I would like to know, do you think the vaccines are safe? If not, tell me why. I'd love to hear from you, because now this episode we're going to be giving opinions. What is your opinion about this? What are some of the rumors that you've heard? What are some of the information that you've had and you're just like, hey, this can't be true? Or, oh my god, is this true? You know, like, what is this that you're hearing? And I want to know in the comments. This one is just, we're going to just discuss it, you know, like laymen, because none of us are medical professionals. But yeah, let me know what are your thoughts about this process. Do you trust the Ministry of Health in this process? What is your biggest concern about this process? Yeah, I'd love to hear from you. And then hopefully we'll keep doing more of this so that I give you more information that is made available to the rest of us. But yeah, I want you to keep in the know, guys. All right, so as usual, please wear your mask, wash your hands, keep your distance. And yeah, I'll see you on the next episode. Don't forget to like, to subscribe. Please share this video with someone, and let's grow this community. All right, bye.